Do you need me to wait for a moment?
Go right ahead.
Okay.
You're recording.
All right, great. So, welcome to the Phoenixville Library for this evening, the 5th of September. Nice rainy night. We're going to be talking a little bit about fibromyalgia tonight. I'm Dr. Snyder, Jeff Snyder. My practice is Snyder Chiropractic. We're located on Egypt Road, at the corner of Longford and Egypt, for those of you who have ever seen that nice old home sitting there in the corner. Inside is nice and modernized. So I've been practicing there for just about 10 years at this point. Prior to that, I was with a group in the area here. So tonight, I like to get out into the community, and I reached out to the library in the past and had the opportunity once again to reach out, and was afforded the opportunity once again to speak. We picked the topic fibromyalgia. I actually gave a couple different topics to consider, and it was suggested fibromyalgia to be a good topic. I guess the librarians know their patrons, so it's a good thing. So I'm going to start off here by just suggesting something to you. Again, I can't walk a whole lot, I can't pace a whole lot, so I'm going to stand right here. And yes, by the way, I'm going to read a little bit here. So you're going to see me reading some because it helps me to stay on track with what it is I want to present to you as well tonight. So there's two groups of people that you'll come across over time. Imagine there's a first group. The first group of people, they're in their 60s or 70s, their 80s. They are enjoying the beach, they're enjoying dancing, they're going out, they're having fun, okay? They're enjoying life, they're living a life that most people would like to have at that point in time, okay? I know that when I get to be 80 or 85 or 90, I hope to be in that category as well. There's another group of people. That group of people, those are the people that tend to have other health issues that are going on, and they tend to have them younger, in their 50s or their 40s, and they'd be lucky to have that kind of a life when they get older. I mean, a lot of us here might be lucky enough to have that kind of a life when we get older. But the question I have is, what's the difference between the two groups? Is it genetic? What do you think?
Some of it.
It might be somewhat genetic, okay? But really, what I really found is this. The majority of the people that I've come across and I've talked to, that I've dealt with over the years, who have that quality of life when they get older, it's because they were afforded information. They had come across information at some point that helped them to learn what they needed to learn and take action on those things, so that way they can make smart decisions. And that's what I'm here to provide for you today. Is you might be in that category of somebody who just wasn't informed, or somebody you know may be having an issue, maybe having a health issue, which you might wonder, why are they having it? And maybe it's because they didn't come across information such as what we're going to present tonight. And that's what I'm here to do, is to provide you information, well, the same way that you would find information in the library. But here we're going to give you that information right now. And the reality is that, you know, if you use some of this information, you might find for yourself that you're going to really have that kind of life. You might find that the direction you're going is you can do an about face, or maybe just a right turn. And you might find that by incorporating some of this understanding, you then can make better decisions. And you may think I'm full of it, by the way. Okay? But give me 40 minutes. 40 minutes, I'm gonna run through some slides here. I want you to get some aha moments from this. At the end, I'll take some questions. And so we're just gonna run through this. Take notes if you like to. But I'm also gonna tell you this. At the end here, I am gonna give you a feedback sheet. And the reason why I'm gonna give you the feedback sheet is because I really wanna get your address, so no, I'm just kidding. No. I mean, that's the reality. That's what most think, okay? I don't blast you with stuff. I don't blast a ton of stuff on email. I do send out once in a while a newsletter. I do once in a while send out something by email, like a coupon or by regular mail. But this is actually a feedback sheet for me. In addition, if you do provide your email address, what I'm providing you here, I have an actual what do you call it? A PDF file that actually has a lot of this information in there. And so if you don't want to take notes, you don't have to, because I'll send it to you. okay? And just need to make sure your email is clear out so I can read it. All right? All right. So let's move along here. So what is fibromyalgia? It's elusive. Fibromyalgia, it's a condition characterized by widespread, migrating, and often debilitating pain and fatigue, which prevents patients from accomplishing everyday tasks. It affects mostly women between the ages of 20 and 50, usually. There are some men that also are affected by it, but mostly women. So looking at this here, at the some of these statistics here, you can see that the National Foundation for Fibromyalgia estimates that as many as 12 million Americans suffer from fibromyalgia, yet remain undiagnosed because of its elusive nature. Although it is most common in middle-aged women, fibromyalgia has become increasingly common in children. Musculoskeletal pain represents the most common problem seen by pediatric fibromyalgists. About 25 to 40% of these children with chronic pain fulfill the criteria for juvenile fibromyalgia syndrome. Fibromyalgia is by far the most common musculoskeletal problem in relatively young people, and osteoporosis leads, but below that age, below the age of 50 that is, fibromyalgia is where the most common problems are, besides rheumatoid arthritis. Up to 28% of adults with fibromyalgia report the onset of symptoms during childhood. So you may know people that have been dealing with this, and whether or not these people have been dealing with it when they're children, there are some that do have the problem and start at a young age. Fibromyalgia was first diagnosed and appeared in medical literature around 150 years ago, but has rapidly increased in the past few decades. Fibromyalgia is the second most common pain disorder seen by rheumatologists and is more than twice commonly seen as rheumatoid arthritis, as I mentioned on the previous slide to a degree. Just waiting for the chart. Come on. There we go. Okay. It was fibromyalgia. The average, so we actually go back over here. There we go. There we go. My screen's slow to change. Dr. Starling, in Fibromyalgia and Chronic Myofascial Pain Syndrome, a Survivor's Manual, he said, the average fibromyalgia patient suffers for 5 years and spends thousands of dollars on medical bills before receiving an accurate diagnosis. That's not fun. And this is not just for fibromyalgia. How many times have you gone to a doctor looking for a solution, spending a lot of money, a lot of time, going for lots of lab work to come up with not much, okay? It's not an uncommon thing. So women tend to be affected more than men, and we mentioned that just before. So why is that the case? Anybody have an idea?
Is it hormonal?
Well, it's actually more because of body size. Okay? So upper back, neck muscles, there's less cushioning. There's not as much soft tissue there as there is in men. And so what happens here in regards to a motor vehicle accident, which a lot of times fibromyalgia can start as a result of some type of trauma, motor vehicle accident being one of the more things that you'll find that people have been dealing with because people drive. And so if you ask anybody, most people will say, yeah, I've been in one accident or I've been in 2 accidents. You might find that rare instance where somebody has fibromyalgia yet has never been in any accident. And there might be other reasons for that altogether. But again, you can go back to trauma, and it can be sometimes even a more micro trauma that's involved. But we're going to talk about motor vehicle accidents here just for a few. Okay? So the majority of cases, it can be traced back to motor vehicle accidents, and the accident itself does not have to be significant, nor does the vehicle have to sustain any great deal of property damage for that matter. So you might think, oh, I had a little bump, a little fender bender. Those little fender benders, they can really affect the body, and I'm going to explain to you why that's the case. Prior to the 1980s, car bumpers were designed to absorb impact. What a simple fender bender of about 10 to 15 miles an hour, what resulted to the bumper back then? The bumpers actually usually fell off. Okay? They absorbed the entire impact. Okay, but this changed in the 80s, And the reason why it changed is because when Lee Iacocca, you see him sitting up there, okay? Lee Iacocca, when he took over Chrysler, and do you remember Chrysler being in really bad trouble at one point? He took over? Okay, good. I remember that too. I was a kid, but I still remember that. They created what was called the K car. I did not remember the K car, but I, obviously came across it in this process here. A different type of frame that would not have significant property damage during the impact, but would transfer the energy inside the car. This mechanical concept was eventually copied by every major car manufacturer around the world. What's the problem though? See, it's good for the car, it's bad for the driver, okay? And the reason why is because energy. Energy itself, that whole thing about energy cannot be created or destroyed, okay? So it's what you see here with Cube with the pool balls, hits, gets dispersed, okay? Has to go somewhere. So NASCAR, by the way, in the NASCAR races, you ever see those races? Oh yeah. Julie up there, by the way. What kind of
Quarter midget.
Yeah, quarter midget racing. I saw one of those pictures. The impact. But the point is that NASCAR racing, you see them hit, and that car just explodes, and we look at that and go, "Oh my God!" The driver inside, he's in a cage. That car is designed to do that, to shatter, because it takes the force applied from that accident and puts it into the car and not to the driver as much. I mean, the driver gets banged up, but not the same way as he would otherwise. All right, let's see. Next screen, there we go. So energy is transferred through the frame of the car and it finds the passenger. Energy is transferred to the body and it impacts the weakest aspect, the head and the neck. Because think about this, you are strapped in, but you're not strapped in. Okay? Strapped in here, your body, okay, won't go forward. When the airbag, thank you. When the airbag deploys, even that doesn't necessarily keep the head from the full whiplash effect. All right. There we go. Okay. All right. So, 85% of all neck injuries seen clinically result from auto crashes, and of those due to such collisions, 85% result from rear impacts. Let's go slow. There we go. Hopefully it doesn't switch again. All right, good. There we go. Okay. So from the Journal of Forensic and Legal Medicine, the evidence is clear that the central nervous system becomes very sensitive after one experiences a motor vehicle accident. So we're getting it right from some great journals, talking about, again, motor vehicle accidents and the effect on how this can cause the nervous system to become hypersensitive. In 1997, a research piece out of the American Journal of Arthritis and Rheumatology said that often that the fibromyalgia syndrome, that is, often shows up sometime after the injury. There may be no bleeding, no broken bones, but the impact and the injury to the body is still there. Okay. So right out of the American Journal of Arthritis and Rheumatology, once again in 1997, the risk of developing fibromyalgia is more than 10 times higher in adults with neck injuries than in other adults. So, by the way, think about this too. We're not just talking about car accidents. We're talking about roller coasters. Your body's in, but your head's not. We're talking about other types of either amusement rides or other types of trauma. And you can probably think of other traumas that one might experience besides something like a car accident. Smaller, repetitive type stresses to the neck as well. How about this stress?
Okay.
Okay, we're doing that today. And that's a whole other can of worms, but it also leads down the same path. So, Dr. Carlett, Department of Physical Medicine and Rehabilitation at the University of Southern California, he said that Head in forward posture can add up to 30 pounds of abnormal leverage to the cervical spine, and this can pull the entire spine out of alignment. You ever see Jerry Maguire, the movie? Little boy in there, he wants to be impressive, and he says, "You know, the human head weighs 8 pounds." Just a line that stuck with me because we talk about that a lot. The human head weighs about maybe 10 pounds, 12 pounds, and when you do have forward positioning of the head, puts enormous stress and tension on the shoulders, on the upper back musculature, and it finds its way down the spine as well. The whole posture changes as a result of that forwardness in the head. There we go. So for every inch that the head goes forward, it can increase the head weight and the spine by an additional 10 pounds. This is right out of a book by Dr. Kapanji, The Physiology of the Joints. I used that book when I was in chiropractic school.
I'm starting to get a backache just sitting here,
telling you.
thinking about it.
Uncross your legs. Exactly. Yeah. Not the greatest place to sit. Okay. Yeah. All right. So, pain. That's what we're talking about here. Not all pain is the same. Can we agree? Right? Not all pain is the same. So, the 3 types of pain. All right? There's a kind where, you step on the foot and that can hurt. But as soon as you step off, all right, for a moment it hurts and then it kind of goes away. Right? Then another type of pain, where you step on the foot hard enough to cause tissue damage, some swelling, some bruising. After a week or 2, pain goes away. Okay? We're not talking about that kind of pain. The third type, step on your foot a year ago, bruising and symptoms are all gone. Foot still hurts. Okay? That's the kind of pain we're talking about. By the way, regarding the feet, I actually have a patient who fell right into that category. Young guy, younger than myself, less gray hair. I think we have a number of us in here can account for that at some point. But the point is that he came in, his wife referred him in, and he was a runner. But he didn't come in for his foot, he came in for something else, and we talked, and I looked at his foot, because we're talking about feet, and it was just exactly that scenario there. And we adjust other joints other than the spine. I adjusted his foot, and he stood up, and he walked, and he was like, "Oh my God, this is incredible." He went running that day. He hadn't been able to run for almost a year, he said. So, considering the idea of a foot analogy here, it can be just like that, and it can be parts of your neck or shoulder area or other parts of your body. The point is that soft tissue does heal, but if that is taking too long and the problem's still there, you gotta look a little bit beyond that point. So, what we have here is a failure to communicate. Anybody ever see this movie here? I never saw the movie, but after looking this up a little bit here to use a good slide, I looked up and I said, that's an interesting movie. I gotta maybe pull it up sometime. The movie is Cool Hand Luke, 1967, starring Strother Martin, that's him, and another famous actor. Paul Newman. Yes. Okay. So the central nervous system is communicating incorrectly. Okay, that's the problem. Failure to communicate, which means that to resolve the issue, we have to address the central nervous system, not treat the soft tissue first. And I'll share a piece here regarding treating soft tissue. I have a woman I'm going to see tomorrow who is a friend of mine, but yet she had been going down a different path for trying to get some care, and she actually, because of some other circumstances, because of distance, she was going to a colleague of mine. But the point is that she was also going for physical therapy for an injury, and it wasn't addressing it. Every time she walked out from doing physical therapy, in other words, exercises, soft tissue, it hurt. I said to her, then we're not dealing with the underlying framework right now. You didn't get that stabilized yet. And that's exactly what we're talking about here. You can't go and treat the soft tissue first. And in fact, here's another great one. You ever see Lethal Weapon, the movie? Mm-hmm. Remember Danny Glover and Mel Gibson? Mm-hmm. Remember every time a chase happened, what happened to Mel Gibson's shoulder.
Yeah.
Right,
Yeah.
right.
Yeah.
Dislocated, remember?
Yeah.
And walk up to it and knock it in, okay? But can you imagine for a moment, you say, wait, before you go ahead and put that joint back in place, why don't we go ahead and try to do this with it, okay? That would be silliness. So the whole idea is that you gotta get structure in place first before you work soft tissue. And that's kind of the emphasis on the slide here. All right, so right out of Scientific American. No one could survive without precise signaling in cells. The body functions properly only because the cells consistently communicate with each other. Make sense? You have to have communication. If you don't have communication, the body's not going to work properly. All right. So fibromyalgia is largely the result of abnormal signaling resulting in abnormal muscle pain and tenderness. Is it starting to come together a little bit? Has anybody come down this path before in understanding? Yeah? Okay. Because sometimes this is new right here. This is like where the light bulb starts to kind of come on, realizing that we're not dealing with see, the pain itself is a messenger. It's telling you there's a problem. Where is it coming from? To treat it in some way pharmacologically isn't really the answer. By doing some muscle work isn't always the answer either. It lies in that realm of what we just discussed a moment ago. All right, and you can kind of see there that there's a couple different points here that tend to be those primary points for people that have fibromyalgia. So out of the Journal of Rheumatology in 1997, they said there is little doubt that fibromyalgia pain is due to intrinsic nerve system dysfunction. Let's move along here a little bit so you have time well. Okay. So out of the Academy of Pain Research, Dr. Lee said hyperfunctional or hyperfunctional neurons along a neural chain prevent normal nerve transmission, causing disturbances in the homeostasis of the cell, tissue, and organ. In other words, when your nerves don't work right, you don't work right. So again, Dr. Gunn, he says, an oversensitive nervous system generates false alarms spontaneously or from ordinary non-painful stimuli. Physiologists now recognize that nerves and muscles can generate abnormal impulses, and the technical term for this is supersensitivity. Again, just reinforcing the concept of neural supremacy. The nervous system runs the entire body. It's making sense, right? Okay, good. All right. And again, here, Journal of Musculoskeletal Pain. An interpretive defect in the central nervous system may be responsible for abnormal perception of pain in the absence of recognizable, okay, that's the key word, recognizable tissue injury. And why did I emphasize recognizable? The reason why is because pain and symptoms are generally the last thing to show up. Okay? The process manifests underneath. It's sort of like having a cavity and you don't feel it at first until you go to the dentist and he takes an x-ray and he says, you have a cavity. I don't feel it. Or the person who had a heart attack. And people usually say, oh my God, John was perfectly healthy yesterday. No, he wasn't. He was heart attacking for 20 years. He just expressed the symptom at that point. Symptoms are the last thing to show up in a process. Okay? All right. Did I click the slide? Yes, I did. Good. All right. So the typical American goes through more physical, chemical, and emotional stress in 30 days than their grandparents did in their entire lifetime, right out of Johns Hopkins University. So these triggers today, these emotional triggers, they tend to also throw us over. So that's one of the other pieces to consider here. And it really, it's not just the emotional trigger. It's the emotional trigger and what it does to us physically. When you're emotionally stressed, we tend to change our body posture. And when our body posture changes, that tension builds in the shoulders and the upper back area. And so that's another piece of the puzzle. So what can we do to manage the emotional stress these days? Well, various things. Anything from deep breathing to some exercise, meditation, stretching, different things like that. And these are basic self-help things you can do. providing obviously these things that you're going to do don't cause you pain in the process as well. So fibromyalgia can be caused by bad posture and any attempt to relieve symptoms without addressing the cause is useless. So this is coming from Dr. Stratton, the Complete Natural Health Consultant. It's a book. So why is it important? Because posture is the visible representation of the protective structure of the body, and especially that of the nervous system. Your posture is dictated by your skeletal, by your spine, and if you have positioning of your head forward, you're more likely to have a loss of curve in your neck and there's tension on those nerves. Homeostasis and nerve system function are ultimately connected with posture, right out of the American Journal of Pain Management. There we go. So, older men and women with that hyperkyphotic posture, which means a loss of curve for the neck, going this direction here, may have a higher mortality rate. This is out of the Journal of the American Geriatric Society. So there's a lot of issues that occur as a result of bad posture. And bad posture can occur from, we go back again to the motor vehicle accident, or by way of stress, or by way of other things that we deal with in today's modern society. Deviations in the body's center of gravity, poor posture, in other words, have resulted in intestinal problems, hemorrhoids, varicose veins, osteoporosis, hip and foot deformities, poor health, decreased quality of life, and a shortened lifespan, right out of the Journal of the American Medical Association. Okay, this is 1957, by the way. Okay? I don't know why they don't talk about it. I don't know why medical physicians don't talk about it, but this is right out of their own journal. All right. I mean, obviously, there's a lot of information to read in journals. Not suggesting that physicians should read every single thing that's out there. I should really go read everything myself, but things that are more obvious like this struck a nerve. And the understanding then is that we have to manage posture, manage the structure. And so Hans Selye, he was a Nobel laureate, 1949 actually, there it is. The beginning of disease process begins with postural distortions. Once again. Okay, so how does chiropractic care? How does it fit into this whole equation? Because we're talking about this, I'm just trying to build the pieces right now for you to understand that posture is an issue because of the structure. The structure itself is affecting the nervous system. You follow that train, that process? Okay. And so why a corrective structural approach is often needed for fibromyalgia. Why is that? Because it's a physical problem. And that's really the basic answer there. So what doctors of chiropractic, and by the way, just a quick show of hands. Whoa, that was nice. Got cold. I don't know if you saw that up there or not. All right. So, start with me. Chiropractic care. Anybody receive care? Okay. All right. Good. And that's a really important piece. Now, the second question to that is, chiropractic care is kind of like saying, you ever hear somebody who said, I went to a chiropractor and it didn't work, or something along those lines. And so I didn't go. Or I knew somebody who went to a chiropractor, it didn't help him, so I'm not going to go. That's kind of like saying, yeah, I know somebody who had a reaction from a medicine, so I'm not going to take any medicine at all. I mean, we're probably going to avoid as much as possible medicine because it can be harmful. But you're not going to totally, or a medical doctor who might have misdiagnosed something. I'm not going to medical doctors anymore. So what I'm saying is, if you're going to a chiropractor and they're addressing these issues, and I assume that people that are in the room here are either here on behalf of somebody else or for themselves in relation to what's happening with fibromyalgia, or are just simply curious as to what the presentation was going to be tonight. But what I can say is that not all chiropractic is the same either. So to get a sound when a motion is done to a spine. That's not a hard thing to do. I can have my 15-year-old walk on my back and get a sound. But it's really about looking at and examining and analyzing the nervous system, and not just finding for where there's a locked area, but actually examining that nervous system to know that you're on the right spot, that the body's really trying to attempt to make the change in that area. And that's really an important thing. Just consider that in terms of what you're doing, and if you're going to a chiropractor that takes that kind of an approach and you know that, then keep doing it, and that's great. But doctors of chiropractic focus on the entire structure of the body rather than just the obvious injured part. For this reason, we can often detect and help to prevent an injury that might normally be overlooked or ignored. And that's the reason why what we do is effective. In fact, and so I'm going to move into asking some questions here in a moment, but I want to just share with you something here in regards to in regards to chiropractic care and the results that are gotten and why they're gotten. In fact, for that matter, the more important thing is why aren't more people going to a chiropractor? Because this information that I'm presenting to you today is something that a lot of people need to know about. And by the way, if you're sitting here and you're thinking to yourself, I have a friend and they should have heard this. They should have heard this, so that way they would have had better understanding about the source of their pain, or a family member, or whoever else. I'm going to give you an opportunity to talk to me about that after, just so we can maybe make a connection for them, so that way they can become educated as well. But I want to share with you that the reason why often the chiropractic care has not been something that has been suggested to people is because when most people, they have a pain or a problem, where do they generally go first? You go to the medical doctor. Mm-hmm. And that's fine. The medical doctors that are in the community are great. I know a lot of them, and they're great people. Some of them come from the old schooling. Some of them are younger. Some, however, are a little bit older. And I'm going to go with the docs who are a little bit older right now. And I'm going to share with you something here that you may have never heard before. And it will help you understand why chiropractors are not suggested first, why conservative measures are not mentioned or suggested first. And the reason why, and it's going to sound like a conspiracy, and I can assure you it's not. Do you know about this?
I'm not sure. Maybe.
Okay. I know who you go to. I'm thinking that maybe you mentioned this. In the 1950s, the American Medical Association formed what was called the Committee Against Chiropractic. You know about this? Anybody? Okay. They changed it, by the way. They changed the name to the Committee Against, the Committee Against Quackery. Okay? They did this methodically, they did this clandestinely. The goal was to try to eradicate our profession. How we found out about this, after many years of chiropractors being not able to have hospital privileges, not able to bowl on the same league as a medical doctor who is on the same league. They were told, you cannot associate with the chiropractor, period. And what it came down to was this. In the 1970s, a packet of information was delivered to a chiropractor in Pennsylvania here who was involved heavily with the American Chiropractic Association. They determined that it was a whistleblower who brought the information to him. In the end, they were able to use this information, and it was credible, and they decided to go to work and sued the American Medical Association. Can you imagine what it took to do that? Okay. Now, things have changed today, but they're still in effect. What we found out was 12 years later, after the suit took 12 years, what they determined was, although they would call us quacks, charlatans, occultists, and so forth, and they would say chiropractors killed people for that matter, they came up with nothing, not one single thread of evidence about this. And what they determined was, the judge determined that the American Medical Association, what they had against us was nothing except for political and financial motivation. And that was it, okay? So the problem with that is this. It's not about poor chiropractors, we weren't able to help people, or we weren't able to, make a living. In some cases it was that. But it was poor people, not getting the right information, not learning what I'm here to teach you today. And today, there's still a little bit of trickle down about that. I talk to physicians. I actually am involved in a degree with the hospital. Okay, so I had an opportunity to be in a little event where there were a lot of physicians. I was the only chiropractor there. I was the only chiropractor actually because I'm on a certain panel. Anyway, the point of it is this. I had a conversation with a physician who's a shoulder surgeon who had just done a presentation a few weeks prior that I saw. And I said to him, Doc, great presentation a few weeks ago. I know that you suggested that if it's not a surgical candidate, perhaps, what would you do? He said physical therapy. And I said, have you ever thought about using a chiropractor? Because I can tell you that often a person comes into my office and I analyze their shoulder and I will adjust the shoulder and lo and behold, the pain goes away. So maybe it's a biomechanical issue before it's a muscular issue, as we were just talking about before. And he said to me, we've never been trained to think about that. That's what it came down to. Okay? So the reason why I'm sharing that right now is simply this. These guys are good guys. These doctors, they mean well, they want to help people. They've been dished information from physicians who taught them, who were taught by physicians who learned this garbage years ago. And the doctors, by the way, who went to school years ago, they went in there and they got what were called quack packs, informational packets that provided them with propaganda against us and an attempt to do what they were doing. But why wouldn't they have believed what they read? Because they were given it in medical school. The doctors who were teaching them said, this is factual, okay? So the point I'm making here is that you're here today to learn something, to learn that your body has a self-healing system, to learn that your body has the ability to heal, to learn that there are things that in our environment get in the way, okay? Car accidents, cell phone, computer, tablet, other issues that can occur, that can put stress on the spine, can cause that forward positioning of the head, that can change the structure. There's a great law that I learned. My background before I became a chiropractor is exercise and sports science. And there was a definition. I'm going to impress you with the definition because it's the one and only definition I think I remembered verbatim. It's called Wolff's Law. And it goes like this: the internal architecture of the body will conform to the direction and the intensity to which it is habitually directed. It simply means if you do this long enough, your body's going to change, and the structure's going to change, and the muscles are going to change, and everything's going to, and you're going to have tension in areas you never had tension before. And you're going to say, what is this? And you're going to go to your doctor, and he's going to say, instead of saying, that looks like a structural problem, let's send you over to the chiropractor down the road. He's going to say to you, well, and this is coming from his training, not about he doesn't like us, just that's what it is. He's going to say, well, let's send you over for physical therapy first. And they do some physical therapy, and it hurts. And you stop doing that. And the structure is hurting, and then you go to a rheumatologist because now you have pain, and you're trying to deal with this thing, and they call it fibromyalgia. Okay? It is a name of something they've given. We've given names to everything. If you have a pain in your stomach, we call it what? You know what we call it? Gastritis. Okay? It's still a pain in your stomach. You have a pain that's back here, pain back there, okay? It's in certain areas, it's muscular, okay? But it's not muscular. It's muscular because that's what pulls and tightens and holds on and tries to hold your body in place with your life. But it's structural underneath it all. So if we can deal with those structural issues, the pain goes away because your body has no reason to hold on tight anymore. The alarms don't have to ring the way that they do now. And that's what I'm here to give you that message right now. Your body heals if given the right opportunity to do so. Okay? All right. So I'm going to pass something around here just so you can look at this. And I'd like you to, if you're interested in getting the informational packet that I have regarding fibromyalgia, I'll send it to you. I'd also like for you to, just take a moment to look and see, just tell me how informative, and by the way, anybody needs a pen, or we have pens over here.
Excuse me, doctor, mine is all dried out, it's not right.
You know something, try it, sometimes you have to rub it a little bit, and it may, these pens sometimes will, no? Try another one. That's fine, please go ahead. If yours is not working, let me know if you need another pen, okay? Oh, okay, good.
Thank you.
Oh, good. Okay, yeah, there you go. Okay. All right. Yeah, good, good, good. Okay. Great, thank you. And importantly as well, we do other programs for other types of topics, including this topic. So if you think this topic would be great in an organization you're a member of, and you think that you'd like me to present that, I'd be more than happy to do so. Are these pens not working? Are you listening?
Excuse me, I need a paper.
Hey, oh, I didn't give you one.
Yeah, that's okay, because I was messing with the pen.
I'm so sorry. Is it not? Oh my God, I'm telling you, let's try another one. I grabbed these pens out of a box of a lot of pens I have, and I can't help that these things are dried. I don't know why. They work. Getting it to work. Yeah, let me try something. I'm going to try something. Sometimes it's like you have to have a little pad. There we go. You just have to have it on the on a surface with a little bit of friction. There. Yeah. All right. And then, by the way, the bottom section here is simply this. It's about intention. If you look at the bottom where it says, people that I know that could benefit by hearing this, I don't want their full names, I don't want their addresses or anything like that. Just write their first name down, okay? Because what I want you to do is think about a person, write down their name, and what we can do is afterwards, if you want me to send something to them or on your behalf, or if you want to just simply say I'm going to reach out to so-and-so, that's fine too. But I want you to just take that intention to write their name and make that a reality. By the way, there are some other things to consider here with regard to fibromyalgia as well, and that is you have to consider about nutrition. Just keep that in mind as well. And there's nothing that's major about this because there's nothing that's really set in stone on this. It's really about reducing inflammation. So and what do I mean by that? There's different types of foods that you can eat that are pro-inflammatory, and there are foods that you can eat that are anti-inflammatory. And so, what are we talking about here? As a rule of thumb, fruits and vegetables, anti-inflammatory. Okay? Better ones that are even more anti-inflammatory, things like garlic and ginger, curcumin, okay? Turmeric, anybody cook with turmeric?
Mm-hmm.
Yeah, okay? So like those types of things, anti-inflammatory. Things that are inflammatory. Fried food, okay? Meats, more so meats that are where the animals are grain fed, but if you get grass fed, it's better. So you want to try to reduce inflammation. There's some great resources out there for reducing inflammation as well. And that's kind of what I would say regarding nutrition. There's nothing specific. There's not like a certain nutrient to take to manage fibromyalgia. They haven't come to any conclusion on that.
Do you address sleep issues, doctor? Sometimes a lot of the way we position ourselves when we rest, or the way we drive a car, I have very long arms and legs, and I was taught that my body mechanics could be part of my situation.
Yes.
And what I've been doing in the summer, it seems like I can only really exercise in the water when it's outside, and what I'll do is for 3 hours, just do aerobics while I'm in the water, and finally after like 3 years of severe hip pain, finally it's going away because I think I'm stretching some of those muscles and to relax. But it's taken 3, and it just seems in the summer, it's just like this past week that hip pain finally went away, even though I was seeing a chiropractor.
Okay. Was he addressing or looking at the hip directly? Adjusting the hip?
You were talking about shoulders. The one chiropractor had to close a practice out of the country. He came back, and what he did, doctor, he just adjusted my shoulder, and for some reason that affected my hip. The other chiropractor that was there, he has sort of like it's like a pinger or something. That's something that's like it's hard on the muscles to break up the spasms, and for me it made it worse. They have to be so gentle.
Yeah.
So
there's different techniques needed for different people, and
but when he adjusted my shoulder,
yeah,
and all he did was he was where my shoulders are, kind of pushed down very lightly, and then they started stretching my leg away from my hip,
Yeah.
Like, my hip
It
is
sounds like there may have been some issues there where the hip itself is affected through what he was doing.
Who knows, who knows?
Yeah, but what you're describing though, it sounds like, you know, providing he was doing the work properly, it doesn't sound like it should have caused a problem, but.
It did.
Look, I've worked on people and done some things where you try to work on an area and something happens and you look at it and you go, that shouldn't have happened. I mean, it sometimes does, but then you go and you correct it as well, you figure out a way to correct it.
They're afraid to adjust me because I react. I
Mhm.
can't be adjusted with a cracking,
Yeah.
like with the
There are
neck,
some
they
light
have,
force. Yeah,
they
there-
have to do the real slow stretches.
Yeah, there are some light force techniques. There's instrument assisted adjusting, where it's a high velocity, low force adjusting tool that we use in the office. There's other methodologies, and there's even real light force techniques out there that are on a different model of adjusting, which work quite well, such as what's called network spinal analysis. It's another great technique.
And sometimes, doctor, if they
Yeah.
adjust, they do those techniques when I'm laying down,
Yeah.
it's horrible, but if I'm
Mhm.
seated up and they do it,
Let me say one thing real quick here before you leave. And the one other woman I didn't get a chance, I wanted to mention that okay, I have your information here. If you have any desire to look at our office, if you're receiving chiropractic care, great, you're satisfied, fantastic. If you're not, you're questioning it. If you just want to see what we're doing that's different, okay? What I'm gonna do is simply this. You come into our office, you came here tonight on a rainy night, okay? I did too. I want to make sure that I give some value to you. I'm gonna contact you tomorrow. Okay, I'm gonna just leave a message, okay, just to say, hey, we saw you. And if you give me a call back within 24 hours and say, yeah, let's go ahead and schedule something, okay? Your first visit's gonna be 50% off. Okay, so I wanna make that clear, just so that way I can help you out and see if what we can do might be a little different than what you've done in the past.
Right.
Okay?
Thank you.
Good. Yeah, have a good night. But yeah, there's problems that people are dealing with here that are real, and this is, you know, I just wanna make sure that I'm here to try to
and
help
one
you.
last question, do you
Yeah.
x-ray on site?
Not on site, no. We do x-ray if there's a necessity for an x-ray. Most of the time I will do so, depending upon what I find during the examination. So for instance, on young children, I won't x-ray. I do evaluate and adjust young children, and that's because I want to make sure their nervous system stays strong, their spine stays healthy throughout life. But on young children, there's not a necessity to do the x-ray because there's usually not degeneration that's occurred at that point. Usually motion is going well, and the adjusting style that I use is not very forceful. So that's the answer as to when I will, and then there are times where I don't necessarily have to altogether, as I just mentioned about the children. So,
I have a question.
Yes.
As far as the outcomes of patients with fibromyalgia getting chiropractic, what does the research say? What do you experience in your clinic? Do you expect like complete resolution, or do you just kind of bring it down to a tolerable level?
it really, I will say that the research is kind of inconclusive to say that we get a specific percentage of positive outcomes. I can only speak for myself in that people that come in with fibromyalgia, yeah, there's a cross of what you just described there. There are some people that have so many facets that are going on that we get some results and their bodies resolve a little bit in pain, but it doesn't entirely resolve because you have to take into consideration how long the problem's been there, how old the person is, what their habits are in life, what their lifestyle altogether is, what they do occupationally. All these play into it. And then you get a younger population where there's a lot quicker results because their bodies are more pliable, they're newer, there's less degeneration, and again, depends upon occupation and other factors. But I can say that most, though, yeah, I'd say almost like 90%, in my own practice at least, definitely get a resolution that's noticeable enough for them to have suggested to me, wow, this is really making a difference. Any other questions? I'm happy to answer anything. Okay.
I have a question. A person that has fibromyalgia, is it common for them to, if they have an injury somewhere in the body, like say they hurt their knee or shoulder or whatever,
Yeah.
at least I've noticed with myself that my whole body will go into inflammation. It doesn't stay localized to the injury there or here.
Okay.
The whole body starts to,
Yeah, you're saying that your knee acts up and then you start feeling it elsewhere?
whole body, the whole body goes into
Yeah.
inflammation.
So I mean, your body's it's this big chain throughout the whole system, and what could very well be happening. And I don't know because I haven't done an evaluation with you, but what can happen is imagine maybe you mess up your ankle, mess up your knee, and all of a sudden you try to walk, and your gait changes. Okay, right? Is that going to affect here? That's going to affect the upper here, and that's going to affect your shoulders, without question. There. So it could be that's what's happening. I don't know entirely, but what I say to that, there's a connection between like a knee issue and then all of a sudden inflammation throughout. Not necessarily. I think it's more of a biomechanical issue of your gait changed, and that may be what's causing the problem. Like, does the same thing happen? Like, you have a problem, say, where your elbow gets inflammation, and then all of a sudden everything else as well?
It seems whatever, well, there might be other things going on. Well,
Yeah.
when chiropractor that I go to, they took digital x-rays,
Mhm.
and my jaw was rotated, and my spine is still
Yeah.
bending to the
Translated
side.
or whatnot, yeah.
Yeah, so I didn't, and I've been going to chiropractors for years, and I was
Yeah.
just shocked when they,
I'm actually taking care of an individual right now that came from another chiropractor as well, and they were told that their spine had improved. And I looked at the x-ray that they brought me, which was the more current one. I should have asked for the original one too, because it was not that great. And I'm not going to say that I have perfect results in what we do either. But what I'll say is that, as I said before, I could have my 15-year-old walk on my back and get a crack. Unfortunately, you're going to get that in any profession. How do you know that you're going to somebody who has the skills? That's the debate. That's an issue that I have myself in being able to suggest to people where they should go. Sometimes when I refer a patient who's moving elsewhere, I usually have to get on the phone and interview the chiropractor to find that I'm sending them to the right place, or hopefully sending them to the right place. And again, usually we're going to get some good skill, but then there's also times where you're not, and you're going to get good skill with surgeons, and you're going to get bad skill with surgeons, and good skills with orthopedists and bad skill as well. It's just, that's the way it is. That's the world. You're going to get a good accountant and a bad accountant, you know.
I mean, the fact that they've
Yeah.
done digital x-rays every year,
Yeah.
I can see the improvement.
Mhm.
Yeah, I can see the changes.
Yes.
But it's, the spine's still leaning.
Sure.
They're working on it, but it's still,
Mhm. Yeah.
you know.
Yeah, you put some years in it, and the body doesn't want to cooperate as well.
Yeah. And the other thing I've noticed is, if I do really, really, really heavy labor, like say a shovel snow,
Mhm.
my muscles will hurt for 3 months.
Mm. Okay.
Is that fibromyalgia, or is that something else?
For 3 months.
Yeah, they'll be sore for,
And you receive chiropractic care during that time frame?
oh, I go
Yeah.
every other week.
Yeah.
Yeah.
Okay. I mean, there's some other considerations here besides fibromyalgia that come to mind.
Okay.
I can talk to you in private about that, just to kind of suggest what I'm thinking about.
Okay.
But there are some autoimmune.
I have autoimmune.
Yeah, there are some autoimmune types of issues that can occur that can have more of an inflammatory effect on multiple joints at one time. So that's what I'm thinking of right now.
Okay.
Okay.
I became very chemically sensitive when I was working at General Electric Aerospace.
Okay.
And my body's never recovered from that onslaught.
Yeah. Yeah. You're not the only one. I mean, not just in GE, other places too. I've had patients who work at various industries, and it's just, it's incredible. You know, big industry uses us, and we pay for it down the road. It's unfortunate, it really is. But I can appreciate what you're talking about, though. Yeah, I don't know if I have a solution, but just some thought about what I'm thinking about. What it could be. Okay. But I would definitely recommend, though, the idea behind the food. Because you're receiving care already, and I know who you're receiving care from, and I think that you're in a good practice. So, and that's not because I'm psychic, it's because she told me before. But the point is that talking about nutrition would be a good thing, and the idea of reducing inflammation. If your body can tolerate fish oil, for instance, that's a good one to implement, to use. Fish oil has
I'm
a lot of...
taking vitamin D, and I'm taking Actually, I'm taking something called, it's from Nordic Naturals, it's actually for my vision, but it's got
Yeah.
DHA.
Mhm.
and other
EPA and
things.
DHA,
it's
yeah.
other stuff in it.
In this case here, the vision, usually you're gonna have a high level of EPA comparative to what you would have. Yeah, I'm pretty sure it's the EPA that's higher with the vision. Wills Eye Hospital uses fish oil now also for some eye issues. The point is that fish oil is really good. Now, some people have an issue because they're taking like warfarin or something that's like a blood thinner, and they say, oh, I can't take fish oil. You actually can. You just have to know the dosage you're taking and make sure that you tell the doctor, and that way he can modify the level of blood thinner that you're taking. Because as long as you're consistent with it, then there should not be an issue there. It's the inconsistency that's the issue.
How important are the right type of shoes that a person wears? And I know sometimes they say that a doctor can look at how your shoe or your heel has worn on either side. How important, doctor, are shoes? And if you address the tightness of the feet, of the muscles in the feet, they say there's so many muscles and bones in the feet. How important is it to really have your feet massaged and the right shoes?
Well, I don't massage feet, but I massage my wife's feet. Okay, so the answer to that is this. In our office, we do utilize some technology, and it's not, it does kind of come into the whole exam process. We utilize some technology it's a laser device that measures the contours of the feet underneath. So we're looking at the arches. The reason why is because if your arches have dropped, if you have good arches, it's great that your foot is held up properly. You have proper positioning of what's called the plantar vault. I'm using my hand as a demonstration, but the plantar vault, okay. And now if the arches have dropped in some way, what will happen is your ankle will roll, because your foot will generally pronate. And when that happens, your ankle rolls, your knee rolls in, your hip rolls, and if it's one side worse than the other, it can cause your pelvis to do this. Okay, so your foundation is really important. So it's one of the parts of the exam that we do is to look at the feet, because if I'm adjusting your spine, but I'm not addressing this here, then that's an issue. And how do we address it? You can't address it through massage or anything like that. It's good to get motion into the spine, to the feet, and you can do. I can do adjustments of the joints in the feet specifically based upon the necessity for what area needs it, and it doesn't hurt, by the way. It really feels good. And I mentioned about that runner; he had a great experience there. But the point is that to address it properly, you really need to have a proper orthotic. If there's really an issue that's significant, if it's a minor issue, maybe not so much. But if it's a significant issue with the arches, then recommendations are usually made for orthotics. And we do orthotics in the office too, again, because there's certain types that we've come across that are really bad. We've had people that have gone to Amazon and just bought some general orthotic, where they went out and got a Dr. Scholl's, and that's not really doing the job altogether. You need to have them made for you, for your body specifically. And then in that way, they last you years, you get the most benefit out of that.
So is that the only diagnostic tool that you use on the person, is their feet?
No, for the feet.
That's the only?
No, for the feet, yes, for that particular aspect.
What other
of that.
diagnostic measures do you use?
So
For the other parts of the body?
Sure. So just to give you a sense of it, because you've been to a chiropractor, and for those who have never been to a chiropractor before, I don't know what the head count was at this point, but to share with you, a chiropractic evaluation generally goes like this. I'm going to look at your posture. I'm going to see where your posture is off. If your posture is off, it dictates usually that there's a need to go a little further in the examination. It tells me that there's potentially a spinal issue, because obviously if your head's doing this, chances are your spine's doing that. So look at this, look at that, look at your range of motion. So I'll have you bending forward, backwards, side to side, looking for restrictions there, looking for areas that are uncomfortable. Same thing with the neck, same thing with the mid-back. If there's a particular issue, say with the hip, I might have you go through the motions for the hip compared to the other side. There might be a few orthopedic neurologic tests that are done. As a result, if there's a need for, say, certain things for the neck, to have you move a certain way, to move your head, and if it provokes pain, then we know at least that there's certain things going on with joints. We might also look at neurologic findings, such as if you're having numbness down the arm or down the leg, then we'll evaluate that, exactly what's going on and how it's affecting the nerve tracts that are going down. And then beyond that, as far as diagnostics, I'm having you lay on the table, and laying on the table, palpating, pressing along your spine, feeling for regions that are not moving properly, doing what's called a functional leg evaluation, where we're looking at leg length to see if the leg itself responds to certain movements. And I can't really describe it further than that, other than to say it gives some positive information, lets me know where and how we're going to adjust. And then lastly, in certain cases, we also use technologies that look at the spine a little deeper, because we want to look and see how the muscles are supporting your spine. And so we'll use some technology to evaluate the muscles and how they're actually supporting the spine. And we'll look at the autonomic nervous system. So that's the part that, anybody heard of autonomic? Okay, autonomic? Think automatic, okay? The part of the nervous system that controls things automatically, such as your heart beating, your digestion, things of that nature. That's the autonomic nervous system. But you need to have your autonomic nervous system properly working as well, because again, you're talking about something you can't control. So there's an up cycle and a down cycle to it. Right, so there's parts of the nervous system that deal with that. Bottom line is that we're going to evaluate them. And then the adjustments, depending upon what I see, I may adjust using a certain technique because I see a certain response in the tests, or a different technique because of something else that we see, or a combination between those techniques. So I went to a school down in Georgia, in a place called Marietta, Georgia, which the locals down there call Marietta. You ever go down south? Mississippi is not Mississippi, it's Mississippi. Okay? Yeah, but the point is that the school itself is a great school, largest in the world actually, I believe, to this day. There are other chiropractic schools around, and up here, closest one is in New York. From what I understand, they teach one technique. You can't get far with one technique any more than you can get far with one golf club. Okay. The school that I went to, I don't even remember. I think we learned something like 12 or 13 different techniques through the school. So I have a lot under my belt, and we can utilize those techniques. So I can say, okay, that is not working on this individual. Let's utilize this methodology instead, and see if we can get better results. And I've done that numerous times, and for those who are patient enough to work with me, we've gotten some great results. Usually doesn't have to take, long time to figure that out either, which is, good for everybody.